All right, hello everyone, and welcome to today's presentation on the Affordable Care Act. My name is Daryl Royce. I'm the AARP Alaska Outreach Director. Happy to have you with us today. And our guest this evening is Becky Hallstrom. Becky is an ACA Navigator.
Yeah.
I understand it correctly. Becky, you are the only ACA Navigator in the state, so we are very fortunate to have you share your time with us this evening. I know we have a couple people who are joining us here in the last few seconds, so I just want to let everyone know that you are welcome to ask any questions you'd like in chat or at the end of the presentation. So with that, Becky, I'd like to turn it over to you and let you go ahead and take it from here.
Okay, thank you so much, Daryl. I'm going to go ahead and share my screen and just kind of show you guys a few things about the program that's changed and hopefully keep your attention. One of the worst things about having my subject be insurance is it's kind of boring. So I try to put in a few memes and things to make it a little bit more interesting. Like Daryl said, I'm a health insurance navigator for United Way. My boss is also a navigator, but she does all the high salary things that I don't like to do, like spreadsheets and all of the paperwork involved in getting the grant that pays my salary. So I love what I do, and I love that I don't have to charge anyone for my services. So today we're going to talk about the Affordable Care Act. This is one of my favorite memes about Affordable Care Act. I just want to go over some things that have really improved in the last few months when President Biden went ahead and did the American Rescue Plan Act. He gave the Affordable Care Act a lot more funding. So there's a lot more people that are eligible for this type of coverage at higher incomes. And then the lower incomes have even cheaper premiums and cheaper deductibles. So it's been kind of a fun thing to be able to tell people I've had a happy job the last few months. And just for the type A people, I just want to go over what I'm going to talk about. I'm going to go over the common misconceptions that people have about the Affordable Care Act, how it works. And then I just want to bring you through 3 examples. I learn best by examples. So that's what I like to use to kind of explain how the program works. And then just some quick strategies if you're thinking of retiring soon, not 65 yet, and want the lowest premiums. I've got a few tips on how to make that happen. And then how to do your own quote and get the right result. A lot of people that I talk to, they're in the hospital, they have no coverage, and they tell me, yeah, I went on healthcare.gov and it was $2,000 a month. And back in the old days, that may have been the case if they had a higher income, but usually the people that I'm talking to were eligible for the tax credit and didn't have the right information. So that's my job, is to make sure that everyone has the correct information and knows what their options are. So the first common misconception is that it's too expensive. That very well may be true. It just depends on what your household size is and what your income is. For people just above the Medicaid level or kind of in the middle, they get very low premiums and very low deductibles. If I have a 25-year-old that's making $50,000, their premium wouldn't be more than $150 a month for a pretty good plan. Now, as you get older, it's kind of crazy. The premiums go down because the tax credits go up. So it's a pretty complicated program, but we'll go over that. One of the common misconceptions is it isn't good insurance. It is good insurance. We have 2 companies in Alaska. It's Premera, Blue Cross Blue Shield of Alaska, and we also have MODA. And most people go with Premera because that's one that's taken more often by the clinics and hospitals, but it's very good insurance. Sometimes there's frustrations with the paperwork involved in getting that tax credit, but that's what I'm here for. I help people with some of those frustrations. Another common misconception is one of your neighbors or friends or relatives have had to pay back all of the tax credits at tax time. And usually that's because they signed up without any help or with someone that doesn't understand all the rules for the Affordable Care Act, or they estimated their income at the beginning of the year and had a banner year. And that premium at the beginning of the year is basically that's what their income is, what gives them that premium. And if their income's higher than what they said, that's what happens. Is I tell them, if you're going to go over income, go way over income so that you can pay all those tax credits back. Now with the new program, it's really hard to go over the tax credit limit because the limits are so much higher. So I don't have as much worry for people on that anymore, which it makes it really nice. And then the other thing is people have checked in the past and haven't looked since April 1st. The premiums have completely changed and the eligibility has changed. So a lot of people aren't willing to look at it again because they looked at it in the past. So if that's someone that please give them the message that they just need to get back in there and look to see what those new premiums and income limits are, because it's been shocking to me. Like every time I look up a quote for someone, I'm very shocked at how many people are eligible. One of the most confusing terms about the Affordable Care Act is the advanced premium tax credit. And basically that's someone is taking their application and putting in what their details are. They are having to say, for this coming year, this is what my income will be, which is a very difficult thing for some people. Some people, if they get a regular salary or paycheck that's the same every week or month, no problem. But if you have a variable income, it's difficult to predict that. So what we do is go in, make the best guess possible. That determines what their tax credit will be for that year. And that's basically just the premium savings that they're going to get. The government pays that towards the insurance. It never is really something that the consumer sees. It's given straight to the insurance company. And then at tax time, they look at, okay, what was the income on that application and what was the actual income earned? And then if you stated your income, you may owe a little bit of premium if it would have made a difference. And if you overstated your income, you will get a refund if that would have made a difference. Some of the things that determine your tax credit is your household income, of course, the age and gender of the folks in your household, their smoking status, and then how many people you have on your taxes. So it's basically husband and wife and dependents. So if you have someone in your household that isn't on your taxes, they are not included and their income is not included in that calculation. I just liked that one. So hopefully you guys like memes. The eligibility for the program is you cannot have an offer of coverage from your work or anyone in your household. If your spouse has an offer of work, even if they're not really contributing to your premium, you still cannot be part of this program, which is what we call the family glitch, because usually the spouse offer of coverage is really high. But even if it's really high, we cannot do insurance for that person because they have an offer of coverage of work. And so that means that this program is not available to them. You have to file jointly if you're married. You need to be here in the United States legally. Your income must be above Medicaid guidelines. You can't just choose to be on the Affordable Care Act. The application either sends you to Medicaid or to Affordable Care Act. So it's just kind of a fork in the road. You must be younger than 65. There is a rare case where if someone has come to the country and hasn't had that 10 years of work credits, then if they have to pay for Part A, which a lot of people do, they have to pay like $400 a month for Part A, then they can choose this instead if they're 65 and older. And then you can sign up for this program any time of the year if you have a life event, like losing coverage is a good one. So if someone were to decide at 64 that they want to retire and they're going to lose coverage, we can do that coverage to continuously cover them through this program anytime once that decision is made and that cancellation is happening. Okay, so here's our first example. This is Bill and Linda. And Bill's 65, Linda's 63, and Linda wants to retire. But she's not eligible for Medicare yet, so she wants to find out if this ACA would be good for her. They have some Roth accounts, so that's not taxable income, and some savings to live on. And he's drawing his Social Security, and then he has a pension. Their income that's taxable ends up to be $53,000 a year. And neither of them have any offer of continuing coverage from their employers once Linda retires. So this is the type of plans that are available to them. So I like to talk about just good, better, best. Usually the bronze plan for someone that has any type of savings available to them is the best option, even though the deductible is high and the out-of-pocket is high. But if you look at the difference in out-of-pocket totals, which basically is the most you're going to pay in 1 year for any health costs per person. Now this is just for her, so only Linda needs to look at this. $7,000 is the stopping point where you've paid your $5,800 deductible. That $7,000 is including that $5,800. And if your bill is $1 million at the hospital, the most you're going to pay is $7,000. Now with this type of income, this is a pretty low income for a retired couple. They should probably look at this $21 gold policy because this one has a whole bunch of copays on it. So it's really nice. You can use those copays before the $1,500 is met and be able to go to the doctor for the little things before with this 179 policy. That one basically doesn't do you any good until you've reached the $5,800. This one at $21 a month, you can go to the doctor for $30. You can get prescriptions for $10, a specialist for $60, chiropractic for $30, several different copays you can use even before you meet $1 of that deductible. So this is a good example of kind of a lower income. This one is $171 a month. Now $2,800 for the deductible instead of $1,500, but the out-of-pocket is $4,000. If I know that someone is going to have a surgery for sure, a lot of people come to me and they're like, I need knee surgery. Then we just do the math and figure out, hey, is that $171 a month worth it for you? Because we know for sure you're going to meet your out-of-pocket. So there's a lot of math in insurance, but we don't have a crystal ball, but we can kind of tell by the past year what the health needs are to kind of guide people into the best policy for them. Okay, second example. This is Steve and Renee. I couldn't find a picture of someone just sitting watching Netflix like my husband and I, but it's a good example of Steve and Renee. They own a small business. They don't have health insurance. They looked at ACA in the past and didn't qualify for the tax credit. It used to be $86,200 was the tax, that was the income limit for being able to receive a tax credit. And I just did a couple the other day. They made $194,000 for their profit, and they still received, I think it was a $500 a month towards their premium. So much, much different world that we're dealing with now. Steve is 57, Renee is 58. They don't have tax dependents. Their dog doesn't count. And their estimate for this year is 110. So much different than the past couple. The differences in premiums you're going to see is a big difference. $3 a month, $528 a month, or $782 a month. Now, like I said before, especially with this couple, this bronze plan a lot of times is the best if you do the math. There are some instances where people have very, very expensive prescriptions, and it works for them better for their budget to do that $528 because the premium, it makes it so that they're able to get a copay for that very expensive prescription. So there are some tips and tricks that we kind of look at to see what is going to be the best for them. But you can see that that premium went up quite a bit to $528 and then $782 for this plan. I would never even allow anyone to think about this plan because, as you can see, the monthly premium is higher, the deductible is higher, and the out-of-pocket is higher. So determined by the income, that silver plan can really not be a good deal for people. Third example is Paul and Shannon. Paul is 64 and so is Shannon, and they only need coverage for about 6 months before they're eligible for Medicare. Because they worked for part of the year, their income for the year they need coverage is $190,000. And again, these premiums went up quite a bit, but $281 for coverage where your out-of-pocket limit is $7,000 is not a bad premium. If you look at what it costs on the open market, this premium would be $2,020 without the Affordable Care Act. So I'm just wanting to show you that, even though it is higher, there's a lot of help. That $1,739 a month is nice to not have to pay for that coverage. And then just if you're thinking of doing this in the near future, especially if you only need your coverage for a year or so, what I like to talk to people about before they do it, if they have a plan in place and it isn't the year that they're doing it yet, you can take money out of savings accounts that are taxable or retirement accounts that are taxable the year before you want coverage. And then you live on that money and be able to have those lower premiums and lower deductibles if your income is going to be lower for that year, because they're not going to look at your savings. They're only going to look at your income for that year that you get the coverage. A lot of people really struggle because they have capital gains and they don't know how to predict that, because none of us know. What I like to tell people is, make your best guess, but if you're gonna estimate lower rather than higher, because you may owe premium at the end of the year, but if you end up with lower deductibles, they never ask for the difference in the deductibles back, only the difference in premium that higher income gives you. So kind of hard to explain, but basically guess low rather than too high, because it may make your premiums higher, and it may make your deductibles and out-of-pocket limits higher, depending on which policy you pick. And then if you have an option to invest in a Roth account, a lot of people use that to keep their premiums low because it's not taxable, of course. And then just basically the annual physical alone is enough to pay for the premium for the bronze plan usually, because you get 100% coverage for anything that is preventative care, and that's for any of the policies. So if you've looked at the prices of an annual checkup with blood work, mammograms, or colonoscopies, it can add up to quite a bit. Okay, then I just want to go and look at how to do a quote online, if it will let me get out of, there we go. So let's just go through on how to get a quote online so that if you want to look up for yourself, you're able to do that without help. The biggest thing that I talk to people about is make sure that you're on healthcare.gov. If you're on healthcare.com or healthcare.org or anything else, you are going to get scammed. And unfortunately, I've had a lot of people come to me that think they have Affordable Care Act and they don't. They have a policy that will pay them maybe $100 a day while they're in the hospital, and they've paid like $500 a month for this worthless coverage. So healthcare.gov. And then all you need to do is type in preview plan in the search bar. And you're going to want to choose the health plans and prices based on your income. This shop plans are for employers. So that's not what you want. You're going to put in your zip code and pick the county, which we don't have counties, but the lower 48 doesn't know that. So we've put in the zip code. We're going to tell us about you and your household. And let's put in, we're going to put in a 64-year-old and a 65-year-old with lower income than what we did before, even just for fun. And I'm going to put that the wife, of course, has Medicare, so we don't need to include her on that quote. Okay, we're just confirming that that information is correct. And let's put in 40,000. This year, it's an odd thing. If you've had any unemployment for the year of 2021, there's a compensation in there where you basically get the lowest premiums possible and the lowest deductibles, even if you make a ton of money this year. If you've had 1 week of any type of unemployment, you get that lowest rate. So this is saying that the husband does get an estimate of $14.95 of savings a month. A lot of people think that's what their premium is going to be. No, that is the savings. So then they go away and don't keep going. So please keep going. This is saying that, of course, the wife does not get any savings because she has Medicare. And then I just close out of that box. And for most of the people that I deal with, they want Premera because MOTA is only accepted. The two big clinics that are accepting it are Anchorage Neighborhood Health and then Medical Park Family, but Medical Park Family also takes Premera. And then the only hospital that will take it is Alaska Regional. So it just kind of depends on where you go, what you would like, but they were part of the exchange a few years ago and kind of pulled out mid-year and didn't pay some claims. So there's a lot of places that do not really like that, that option. So I'm just going to pick out 3 plans to look at that would make the most sense. And I'm going to compare those 3. So here we have the same plans that we looked at before with those other examples. And I just want to show you a couple of things that you can do to kind of play around with this. Premiums are much lower because the income's lower, $1.82, $12.81, and $53 a month. And you'll notice because we put that income lower, the deductible for this silver plan is $1,000 and the out-of-pocket maximum is $2,000. So that's a really nice plan. I kind of wish I had those deductibles myself. One of the things that you can do is kind of go down into the plan documents, and each of these has a summary of benefits. And it tells you everything you wanted to know and probably a lot more, but really lays it out really well. So I really like this. I send this to people as they sign up for the insurance so that they understand how their insurance works. And it kind of gives you some examples of, hey, if I have an outpatient surgery, a lot of them have like, if you have a baby, that kind of thing, if you're in a hospital stay, those type of things, what your expenses are going to be. So that's a good resource to have. And then several other things. And then each of these drop-down menus has some different options for seeing what those copays are. So for that silver plan, it's a $10 copay to see the doctor and $45 for a specialist visit. I know I'm talking fast, you guys, but I just want to kind of give you an overview. And then we'll finish up from there. So let me get to. Of course, now my thing isn't working. Okay, so one of the things that I wanted to just urge you, if you want to do your own quote, If it doesn't seem like it's the right amount at the end, please call me. I would love to help with any of that. I also would love it if you come to me and ask for help with the application, because so many people tear their hair out because it's supposed to be user friendly, but not all that user friendly. So I can help you over the phone, via Zoom, and then in person as we get closer to open enrollment or a special enrollment period if you were to lose your coverage any time of the year. So basically that's an overview of some things to think about and hopefully share with others so that we have the option of getting people signed up. We have until August 15th right now to do that, application. And then once that's over, then November 1st to December 15th, I think they're actually extending it to January 15th this year, but we haven't heard for sure. But for January 1st coverage, that's the open enrollment. And please don't call the marketplace if you don't have to, because basically you're going to get paragraphs by people that can't really help a whole lot. So this is my phone number. That is my personal cell number. Not personal, business cell number, but you can also call 211. That's an easy way to get a hold of me. And we will be expanding our program to have more navigators very soon. So hopefully that is something that happens quickly. And Daryl, that's the end.
Great. Looks like we have a comment and question here in chat. It says we signed up for ACA in November of 2020. Our premium is reasonable. From what I hear, is we should revisit the plan to possibly change our premium. What would you say to that?
Yes. So if you haven't been in that application since April 1st, go in and do a life change is what you would call it. And you just pick the first option, changing your income, which really isn't the case, but that's the way they've instructed us to do that. And as you go through the application, just make sure everything is still correct. And at the end, you'll need to choose a plan. If you stay with the same plan, you'll see a reduction in your premium. If you decide to change plans, just remember that that deductible starts over again. So please call me if you want any help with that. I do that all day with people. It takes me about 10 minutes to do it. But it's an incredible savings. And if you haven't done it, and then you go in and do it, the months from January until you get that completed, you'll get those same savings from the first of the year back at tax time. So you're still going to get those savings even if you haven't done it right away. But it's been a super fun thing to have people call and do that life change with them, because almost everyone has been amazed at how much lower the premium is.
And Becky, do you recommend that people contact you and set up an appointment, or can they just give you a call and say try to catch you, or send you an email? What's the best way to get in touch with you?
The best way is to give me a call or text me at that 313-0199 number. They can definitely send me an email as well. What I usually do is just return voicemails. I can usually get to people within the same day, if not by the next. If I have a full schedule, we'll just set up a time to talk if it's going to take a little bit longer than what I have. But a lot of the time I can take care of it right then. So especially with those life changes, they're pretty fast, and it doesn't take a long time to get that updated.
And if people say could qualify for Medicaid, or maybe they would qualify for Medicare, they don't need to despair, because you can help them, kind of send them in the right direction, right?
Correct. I help people sign up for Medicaid all the time, the under 64 and under crowd, and help them with the frustrations of dealing with the Division of Public Assistance. And then Medicare, I answer questions about that all the time and can send them to the correct people that, Daryl, you've dealt with all the time. They're kind of my heroes. The Medicare Information Office gals are just incredible. But a lot of people have questions on the transition, and I help people with that all the time, and what to expect and when to contact the Medicare Information Office to get them transferred over as they're turning 65.
And speaking of Medicare, if you are age 65, you have Medicare, you've enrolled in Medicare, are you then ineligible for an ACA plan? And then do you have an option to switch if you wanted to go back once you've been on Medicare? What are your options?
The only option to be on the Affordable Care Act is if you have to pay a premium for Part A because you don't have enough work credits. So if you have Medicare, you're not allowed to have ACA unless you have to pay a premium for Part A. So most people are not eligible once they turn 65. There are a few that, are basically immigrants that came to the country too late to get those 10 years in, and then they can stay on there as long as they're not eligible for free Part A. But there isn't a choice if you have free Part A.
And so if you're enrolled in Medicare and someone tries to sell you an ACA plan, they should not be doing that.
That's illegal, and they should, not be doing that.
So I would like to open it up to anyone now. If you have any questions, feel free to unmute your microphone. You can drop a question in chat. We've got some time remaining for the presentation here. So if any of you out there have any questions, now would be a good time to ask Becky those questions while we have her undivided attention. And I'm just going to let everyone have a few seconds to see if they come up with a question or want to unmute themselves. But Becky, while we kind of wait for people to do that, you did talk about the August 15th deadline. That's it's a hard deadline for enrollment. But if something happens to you after August 15th and you lose your health insurance, you're not excluded from enrollment. You just have a special enrollment period of some type, correct?
Correct.
Okay.
So if you lose coverage, you've got a 60-day window. And if you can get to me before that actual cancellation date, and we do the application in the month before that, the first of the month of, when you're going to lose that coverage, if we can do it in the month before, you can have seamless coverage. So it's not waiting around if you don't want that lapse in coverage, but we have 60 days to do it. You may have a month or two without coverage if you wait until after, but we still have that opportunity to get you signed up.
So if I hear you correctly, there is an opportunity if you play your cards correctly, where you could basically avoid a coverage gap.
Yes. So if someone has a September 30th deadline that their insurance is canceling and November 1st or October 1st, they're not going to have coverage, in the month of September is when we want to do that application, because that application would give them coverage for September 1st, and then they have coverage continuously and no days without coverage, because of course, Murphy's Law, that's always when something happens.
Right. We have another question in chat. Did the poverty level change with Biden's efforts?
No, the poverty level didn't change. So we're still at the same Medicaid limits. What changed was the limit of people, the income limit for who's eligible for the tax credit. And it used to be that we had these hard and fast rules by what household size, what your income limit was. But now, because of the tax credits and the way that they've set up the system, it all depends on who's in your household and what your premium is to start with. The limit on that premium is 8.5% of the household income. It cannot be more than that. So it kind of depends on where your income is, what your age is, what the genders are, whether you smoke, all of those things kind of go into play. And then until you reach that point of 8.5%, that's when you're going to pay full coverage. But below that, it's kind of hard to explain. I'm sorry. The income guidelines just are very fluid with the details of your household, is what I'm trying to say. So that's why it's so nice to just go on healthcare.gov and do a preview plan and punch your numbers in and see what your tax credit is. And if you have any trouble with that, I'd love to do that for you as well.
Great, great. So I do want to give everyone, we have another question in the chat. So should I drop employer healthcare coverage and encourage our employees to sign up with the ACA, myself included? Our premiums are okay, but our deductible out of pocket is very high. Seems we could all save money this way. Can you advise me in that anyway?
Absolutely. I talk to employers about that all the time. One of the good things to do is to talk to your employees about what is their household income, because if their spouse is also employed and they have a high income, that would kind of put them out in a place where they're not eligible for a tax credit. So it just kind of depends on your employees and your employees' situations, how many children they have, what their other incomes are in the household, and smoking status, all of that stuff. I have a lot of employers that just gather that information and send it to me, and I can just send them the quote to see what it would be. And then they work it out with the employee instead of having to pay these high premiums through this group plan. They work it out with the employee to get that reimbursement to them. There's a little tax stuff involved there, and the employee has to be the one to pay the premium. It cannot be paid through a company type of account. But a lot of people have started doing that because it's been so difficult for small businesses to be able to get that insurance for their employees. And it's actually a disservice a lot of the time for employers to offer coverage, especially for the spouse, if they're not going to help with the premium at all.
All right, I'd like to give everyone just another minute or two here to see if we have any other more questions, any additional questions. Feel free to drop your question in chat, or you can unmute yourself and ask your question live. And while you're thinking about that, just wanted to let everyone know that this presentation is being recorded and it will be available in the very near future through AARP. We record these and put them on our YouTube channel. So if there was a moment where you want to go back and revisit some of the information that you learned during this presentation, you can do that during the recording. Of course, you can always reach out to Becky as well and contact her directly, and see her contact information is on the screen. So I don't see any more questions in chat, Becky. I don't see anyone unmuting themselves to ask a question live. So I think you have done a fantastic job at explaining this and sort of letting us dip our toes in the pool, if you will, on the ACA. I know that the deadline is approaching here on the 15th, which is that's the primary reason we wanted to be here and have you offer this presentation with us today. So I really appreciate that. Today's the 5th. We have about 10 days. I would imagine that you will probably see an uptick in your call volume in the next 10 days. But hopefully we can help get the word out and let people know that there are some good options when it comes to healthcare coverage. So with that, Becky, I'd like to thank you very much for sharing your time with us this day. And we got some thank you messages coming in, some great info coming in from some of our participants tonight to thank you as well. And if you would like any other information about AARP, feel free to visit aarp.org/AK. And with that, Becky, again, thank you so much. Wish everyone a great afternoon and evening. And if you have any questions, please reach out to Becky. Her contact information is on the screen. So thanks again, Becky, and everyone have a great evening.
Thanks so much for having me.
Take care.